When we started, this, as they must have told you, it started as a hospital. But then I thought we have to go one step further. So we started BSc nursing. So this course was going on, and when I heard about this physician assistant course, we formulated a system. We formulated the whole syllabus. What happens is we identified a physician assistant comes between a doctor and a nurse. So she is quite skilled, and she's of course little more than a nurse. She knows more about it because they do a lot of anatomy and physiology and biochemistry and all those subjects.
So most of your students are want just to have a career.
Yes, they want to have a career. So they go into the different avenues, and if they know like there is a market for them, I mean there is opportunities for them abroad, I think more people will take up this course. Because one of the reasons why a lot of people take up nursing is they can work abroad.
Studying physician assistant.
According to me, my goal in life was to become a medical missionary, and that's exactly why I wanted to do MBBS. But since I was unable to do it, but still I didn't feel bad when I was invited to study physician assistant. I was still very satisfied because after doing this course, I'll be still able to go and just carry on with whatever goal I have.
Actually, I'm very lucky to take this course because I was also aiming for MBBS. So I think I will be able to achieve my success through this course. So I'm thinking more about this. Any MSc courses are there in abroad?
Probably in the United States or in England. Yeah, those would be the best places to look. I'm not sure though which ones.
So how does the PA students differ from nursing students?
It's a very interesting question. Since I'm a nurse, I have completed MSc nursing. PA students they are studying very in depth about assessment, clinical examination, and even prescribing medicines. Okay, their depth of study is so good and so wide also. I have got a very dedicated team of my faculty. Those who are, they are highly specialized and experienced. They are my support, and with help of the other non-nursing, every day we are doing lot of activities, academically, non-academically, extracurricular activities, because they should develop that all-round development, holistic development. Not only education, leadership skill they have to develop, organization skill, decision-making skill, clinical skill, because nurses and technological professionals, they have to work with the patient. They have to work in the ward.
How are your PA students?
So PA students really they are good in their performance, and they have keen attention in all the areas, I can say. And they arise so many questions and clear their doubts.
So they have a good attitude towards the patient. They how to diagnose and how to take care of the patient, as well as they help with the physician. So they're very good students. They are very active students.
Last month we had a conference regarding the critical care and ICU things. They attend very smartly, and they are good. They are good in studies, and also their performance in clinicals is very good. They are helping the both nurses and also the doctors.
All your medical resources,
Pardon, sir?
medical books.
Yes, sir, many. Your research journals, anesthetic, cardiology.
Everything you're
Everything in English.
English. Okay. Why?
The system, the curriculum itself is in English. It's a medical thing.
Profession cannot be done in our own language because commonly they should go abroad, they should work in other countries. So English is a good medium.
Easy to follow. This is OBG lab, obstetricals and gynecology lab. So we have all the dummies as well as the posters, and here they will be training them.
This is like a mother.
Like a mother.
Is that class bell?
It's actually exams are going on. So they are ringing the bell for the examiners to know the timings are over.
This is pediatric lab, sir. They have for the physician assistant pediatrics one subject. In their second year, they will be utilizing this lab, like based on the growth and development of the babies, how they are, and as well as immunization schedule, fetal development, all these things they will be learning. Stimulation lab.
So this
For the sutures, how to make the sutures there, IV cannulas.
This is for emergency room.
Emergency as well as for the PA when it comes to the specialty, cardiac specialty, we will be taking. Here we have computer labs. Whatever we will be giving in certain, like when it comes to the third year, we will give certain research topic to them, and they can get the knowledge, like whatever the syllabus based few informations, whatever they want to get from, they'll search in the Google and they'll other things we are teaching them.
So computers are important.
Yeah, yes sir, computers are important. This is an anatomy lab which we will, the first years will be utilizing for their anatomy and physiology. There are so many models, and as well as they can read the blood and other structural things, bones, skeletons.
So we have model for everything in here. So can you talk about making models? Why is it important?
So when they will be doing the models, they will be knowing the structure in detail. They will be able to understand how the physiology is happening in our body. They come to know about that particular system in detail.
Here is below. You have to come. See if you can come and touch. I have to take that out. Our entry point here below our entry point.
Can you talk about the procedure you were doing?
The procedure which you just witnessed is in a percutaneous tracheostomy. It's been done in the ICU. These people requiring long-term ventilation, people who are not able to come out of the ventilator in the near future. Just to help them to come off the ventilator, we do the tracheostomy. So they can be do a tracheostomy can be done in theater as well as in the ICU, which with the technique is percutaneous tracheostomy. We uses the bronchoscope. So normally it is our physician assistant does the bronchoscope, and I do the percutaneous tracheostomy, or my colleagues, other colleagues do the percutaneous tracheostomy. So basically bronchoscope is put through the endotracheal tube. You put the bronchoscope and you identify the trachea and give the location for the needle to go via the percutaneous route. So we put the percutaneous route here. So from the bronchoscope we confirm we are in the right place. We are not in the wrong sides, or we are not puncturing the posterior wall. So it helps to identify we are in the right place. So you put the guide wire, and then throughout the procedure is being monitored by the bronchoscope. You can do it blindly also, but the complication rates are very high when you do it blindly. So when you do the percutaneous technique, those complications are very, very, very less.
And how important is the PA to be there for you, and how much easier do they make it? Or?
Not only this particular procedure, but they're tremendous help, because their theoretical knowledge is as good as MBBS doctors, because they do 4 years. In that 4 years, the syllabus, if you go through the syllabus, because I'm one of the trainers for them, so that the syllabus they have undergoing is much similar to the MBBS, the doctor's undergraduate training. And moreover, it is focused, and it also includes the other aspects which is not taught in our medical curriculum, like resuscitation and about triage and patient discussion, communications. My physician assistants, they do a lot of the follow-up work, where after the resuscitation, patient comes to the ICU, we do all sort of definitive procedures. When they go back, they follow up them in the ward. Not only about their medical needs, but also about social needs and their rehabilitation, mobilization, physiotherapy, supportive therapy. They do a multiple role, and in fact more of my patients know them very well than me. So that is the kind of rapport they have, these patients, relatives and patients.
Can you talk about what you do and your role you play?
We are coming morning and doing a rounds in ward. We'll go and see the patient pulse, heart rate, pulse, BP, and auscultate that patient, and we see the chest x-rays, and we see the blood reports also. In early warning score also we see. Once early warning score is low, in anything has happened, we inform to our doctors, and the patient, any sick patient is involved, we shift the patient to an emergency department.
And how is that? How does being able to be a PA and contribute, how is that?
I'm very proud of you, because I'm a physician assistant. I'm doing a good job here. I'm doing a good work to my patients also. That's what main thing. I'm very happy to work physician assistant.
I think it's an important inherent component of the medical system to have people in this category who would ably assist a busy clinical unit, especially those physicians who are extremely busy and who have the ability to enhance their work by able assistance of a physician assistant, because the physician assistant takes the load from the consultant in several things, which gives ample time for the physician to focus more on few more patients.
So as a surgeon, I am working in a tertiary setup, and my specialty of spine surgery is not very popular among the entire society. So there are not too many number of spine surgeons around this country. So I have to see a lot of patients in the outpatient clinic, like more than 100 in a day. So for me to clerk all the patients on my own takes a lot of time. And these physician assistants, they act as an important, they act like something like a buffer in between a surgeon and a nurse. And so they clerk the patients, get all them investigated, and prepare them for surgery. And during surgery also they work as surgical assistants, help us get through the surgery, and they like closure of the wound, harvesting bone grafts, they contribute. And another important area where they are really helpful to us is in documentation.
India is trying to push for like a universal health care.
Yep.
Will that increase the need for PAs in a certain sense? Or?
There is so much of need for healthcare professionals in India at various categories. And the government is not going to be able to increase the number of doctors significantly, because there is a problem of dearth of medical colleges and there is a dearth of medical teachers. So the increase in number of doctors needs so much of investment and so much of infrastructure. I don't think that's going to happen. So I think the government should concentrate on PAs, because they have such a very good foundation of basic knowledge. It's a 4-year course. They learn anatomy, physiology, they learn everything. So they are very sound people. So I think once the government recognizes this course and recognizes this category of medical professional, I think there will be a lot of people who wants to do PA.
It's changing. What up there?